So today we are going to talk about the muscular system, the muscles, which has an important role in your yoga practices. Just to follow the things the way that how to learn about the muscles. Sometimes as the people see the muscle over there is a fear that how to learn these muscles. But when you practice constantly and going through the revision again and again, it is very easy to learn about the muscular system. And this is the most important system for the yoga practitioner in relation to your asana practice. So what we have to do, guys, now, if I am going to give you the brief introduction about the muscular system, that the muscle has origin and insertion, right? The muscle has origin and insertion. If you look at this muscle here, the name is the ILIOPSOAS, right? So ILIOPSOAS, if we look at here, the origin is from the pelvis and the lumbar spine. Pelvis and lumbar spine origin is the starting point from where the muscle starts, from where the muscle originates. Then when the muscle starts, then it has to insert at one point where it ends, or the attachment point. So the finishing point or the attachment point we call the insertion, where it gets insert. So muscle has origin and insertion. Now if you go a little bit more deeper here, then we can see the action. So action is the anatomical movements which we have discussed in the anatomical class. The anatomical movements like flexion, extension, abduction, adduction. If I talk about you that the muscle biceps, right? So biceps, you could not say like that the function of the bicep is to bend the elbow. Bending of the elbow is not the function. That's why we have discussed all the anatomical movements in anatomy. So action is the anatomical term. Different muscle has different action. Flexion, extension. So if we start with the iliopsoas, two muscles. The one we say iliacus, another is the psoas. So it's not a single muscle, but the name and their function is same. So that's why we say that iliopsoas. If we divide the term ilio and psoas separately, so psoas comes from here. If you look at here now, this lumbar spine, we have discussed in the anatomy, this is the 12th thoracic, the last pair of rib attached to the 12th thoracic spine. So from here the muscle originates, then L1, L2, L3, L4 and L5. So then from lumbar it originates from T12 and between L1 it starts and it is going like here this way. So this is the psoas muscle, right? We have discussed that in the anatomy this is the hip bone. And this is the hip bone, this is the part we call iliacus. Iliac crest, the largest part of the hip bone, iliac crest. So from here the iliacus come, the ilio, which we say ilio here. So iliacus come from here, psoas comes from here, and they both attached to the top part of the femur here, right? The top part of the femur just below the head of the femur. So this is the insertion. So muscle originating from the lumbar, that is the psoas. From the pelvis is your iliacus. They both attach together and form a tendon and attaches to the top of the femur, that is your thigh bone. And the action of the muscle is hip flexion. If you guys remember how we do the flexion of the hip like this, so this is the hip flexion. And this muscle is deep. If we go through from the front part of the body, as we take the abdominals out, we go to the spine, then from the side of the spine, from the side of the vertebral column, you find that the muscle is coming from the side of the spine, psoas, and as we go deep to the hip joint, to the hip bone, into the front, iliacus, and attaches to the femur. And the action is the hip flexion. So as we have discussed earlier, on the projector, the muscle iliopsoas, guys, right? Now, we'll demonstrate you like a little bit on your body where the muscle is situated and what is the function of the muscle, in which poses the muscle contract and in which poses the muscle stretches. So when the client comes to you, when a student comes to you guys, sometimes there is a tightness in the iliopsoas. How to check this tightness, that we can also discuss. How to stretch the muscle, that we also discuss in this class. So stretching, when I'm talking about the stretching is always opposite to the action of the muscle, right? The stretching is always opposite to the action of the muscle. So today we are going to talk about the muscle ILIOPSOAS. So Shobit is with me here once again to demonstrate the muscle and the pose for you, in which poses the muscle stretches and muscle contract. So can you please come to the laying down position on your spine. Is it okay for you? Can I take your shirt a little bit up? So guys, how to check the muscle? Here we can see, if you check the navel region, right? The navel. So navel, if we go behind the navel, we found L2. So navel is at the level of L2. If I go slightly half inch up, L1, T12 here, right? So T12 here. So muscle basically originating from here, going like this way. And from here, the bone is the hip bone, right? From here, the bone is the hip bone. From this hip bone, if we go inside, from here the muscle comes, that is your iliacus, right? The iliacus. So from here, psoas is coming. From here, iliacus is coming deep. This is the abdominal. If we go deep and just slightly press very gently, from here you can find psoas and iliacus, and they both attaches to the top of the femur. Sometimes you're trying to press, you find trigger points here, right? Because of the over contraction of the muscle ILIOPSOAS. So it attaches to the top of the femur, as we have discussed in the earlier class with the projector, that where the muscle attaches. So from here the muscle originate, from here the muscle originate, attaches to the top of the femur. If I ask my student now, can you please bring your left leg up more, slowly and slowly, slowly and steady. And our focus has to be here, right? Can you please bring more, more, more? You can feel the contraction is coming. If you are right now, you are looking to the video, just lay down and try to do this movement, guys. Or you can practice with your student to lift up, lift up, lift up. So this is what is happening here. Shortening of the muscle, shortening. When the muscles get shortened, you can find the contraction is happening here now, right? So this is, we say, hip flexion, release. So now the question comes like, if you are doing the poses like, if you are going to raise your legs up, both legs up, you can find that the contraction of the abs, but contraction on your muscle ILIOPSOAS 2 is happening here, release, because no muscle work in isolation, right? There are some muscles that supports the main muscle to give some protection to other parts of your body. So this is the way, guys, how the muscle contracts. So this way the muscle contracts. Now if we say how to check the tightness on the ILIOPSOAS, you can see, just can you please lay down on your belly. So here we can see that if you want to see that the tightness on the ILIOPSOAS, this is the pelvis here. If I see, if I'm going to go this way, here you can see his pelvis is not tilting anywhere. If the person has tightness on the ILIOPSOAS, as you're trying to do this, pelvic tilt on the one side. Right? If this side is tight, so other side pelvic droops down. So how to stretch this ILIOPSOAS? You can stabilize here, hold it above the ankle, and ask the client to lift your knee up, and this way you can stretch. You can ask the person to push your knee down, push your knee, release, and then stretch more. So this is the way we can stretch. We can stabilize from here, this pelvis not tilted, and stretches like this way. So this is the stretching of the ILIOPSOAS. But sometimes you don't have a partner, so how to do this stretch alone? Can you please come to the standing position, Shobit? So for ILIOPSOAS, if I'm saying how to stretch by self, can you go for the low lunge? This is the way you can stretch the ILIOPSOAS. So this side ILIOPSOAS is stretching here now. The left is stretching and the right one is contracting. Because right is in the hip is in the flexion, but the left one is in the extension. So this way you can stretch your muscle ILIOPSOAS, the hip flexor, right? So now we can see, can you come to your knees please? On your knees, kneeling position. So if the person has a problem with the backward bending, Because if the iliopsoas is tight, they won't allow to lengthen, right? They won't allow to lengthen the muscle. So if the backward bending is the challenge, must check the tightness of the iliopsoas. Most of the people who has more sitting jobs, standing jobs, iliopsoas contract, over contract and gets more tight. So that's why first stretch the muscle, iliopsoas, come to the low lunge. So this way you can stretch it with the both side first, 15-second hold, 30-second hold, 2 to 3 repetitions each side. And this way you have to stretch your iliopsoas. Come to the standing position. Try to get to the forward bending. So here we can see when I'm doing this forward bending, you can feel what is happening here. When he is going for the forward bending here now, what is happening here? Muscles get shortened. So iliopsoas also engaged. Release. So you can feel this contraction. You can go with these stretching techniques. Try to find out how to get into the pose safely, because if you are not working on the muscles, then there will be more injuries. So be careful, guys. That's why we are discussing the muscles in more detail. Any questions, any queries about iliopsoas, feel free to ask us. Till then, namaste, enjoy your day. See you in next class.